Trevor Khan.
Thank you, Mr President. Mr President, my question is directed to the Minister for Health. Minister, would you agree that in the development of any proposal for major capital works associated with a hospital development, an essential early step is the formulation of the Health Services Plan? Minister, are you aware that an FOI request was placed with the Hunter New England Area Health Service on 22 July 2008, seeking, amongst other things, the Tamworth Health Services Plan? Minister, are you aware that on 10 September 2008, the Hunter New England Area Health Service, in its determination, indicated that access to the Tamworth Health Services Plan had been deferred pending its publication? Minister, can you now advise the House whether the Tamworth Health Services Plan has been finalised, and if so, when? Minister, if you cannot provide for the release of the Tamworth Health Services Plan immediately, when will it be released?
I thank the member for his question. The answer to his last question is I will find out when it's anticipated that the Tamworth Health Services Plan will be released, and I'll advise him of that. I think also the second last part, or the penultimate part of his question, asked me about the deferral of the publication of the Health Services Plan, and I will also ascertain the reasons for that and address. I'll reply to that at the earliest possible occasion I can. In relation to the balance of his question, I'm not going to play battleship around the issues and gameplay around the planning processes of the health services. Yes, it is obvious that major capital works, major health infrastructure is planned very responsibly around very extensive timelines that actually go beyond the normal budget 4-year forward estimates, well beyond in the case of health planning because of the complexity of planning health facilities and because of the rapid change in community expectations, technology and other demographic factors. So clearly I am satisfied in a general sense and quite a specific sense with the level of planning and the level of competence and expectation around health planning in this state conducted by the Department of Health. There obviously are issues around the publication of the Health Services Plan. I will ascertain the general reasons for the deferral of the FOI or the termination of the FOI on the 10th of September, and I'll advise the member in due course.